But let's start today with what is the biggest story building up day after day. The COVID surge continues relentlessly across India. These are the latest numbers. In the last 24 hours, more than 2 lakh cases have been found for the first time. So 2 lakh cases added, 2,739. Deaths in last 24 hours, 1,038, again crossing the 1,000 mark. Active cases now at a new high of 14,71,877. And as these cases mount, the pressure is building on hospital infrastructure across the country. Our reporters across India now file these reports to give you a sense how the hospital system is beginning to creak. Take a look.
This is the sound you hear now in almost every hospital. Families sobbing as they lost their loved ones to the coronavirus. This is the family of an ex-serviceman who died at the hospital doorstep. He waited for hours for help, for medical intervention, but nobody came. He passed away at the door in the scorching sun.
बोले भी कि पापा को अंदर एडमिट कर दीजिए, उसके बाद जो करना, तो धूप में छोड़ दिए पापा को। हम बोले थे कि अंदर कर दीजिए, धूप में बहुत लो हो गया पूरा। लास्ट में पापा हमारे नहीं।
This tragic scene played out as the Bihar Health Minister visited the hospital and the group of senior doctors was busy accompanying the minister.
बेहतर स्वास्थ्य सुविधा देने का कोशिश और प्रयास हो रहा है। अस्पतालों में निश्चित रूप से विगत कुछ दिनों में अचानक से संख्या बढ़ी है और इसीलिए स्वास्थ्य सुविधाओं को बढ़ाने का लगातार प्रयास हम सब कर रहे हैं।
मंत्री जी यहाँ पे डॉक्टर चिल्लाते रह गए, डॉक्टर चिल्लाते रह गए, कोई डॉक्टर नहीं आया, कोई डॉक्टर नहीं आया।
And this tells you better than any statistic that our healthcare system is crumbling amid the second COVID wave. There are no ambulances left, and that is why bodies of COVID patients were transported in a garbage truck in Chhattisgarh's Rajnandagaon. There are no hospital beds, and that is why this 70-year-old man was administered oxygen in his car in Lucknow.
The major problem is of ventilator beds. Many patients are requiring ventilators, but the ventilators are not available in adequate quantity. So what basic issue is, whenever some patient is very bad, it is very difficult for us to manage that patient on emergency basis.
But can we really blame hospitals? Our healthcare workers are working round the clock, putting their lives at risk to accommodate patients. And that is why hospitals now are bursting at the seams with patients being taken care of even in the lobby. Me? Bureau Report, India Today.
And joining me now is one of the country's top virologists who's tracked this pandemic from day one. Dr. Gagandeep Kang joins me at the moment. Appreciate your joining us, Dr. Kang. 2 lakh cases added every day now. The death count has crossed over 1,000 in the last 24 hours. Will it get much worse in your view before it gets better? What lies ahead in these next few weeks? There is a lot of worry, a lot of concern.
I think if we track the numbers, right now everything that we are looking at is an upward trajectory in most places. What we should be watching out for is the test positivity rate, which will be the first to show a decline. And after that, we will begin to see a decline in hospitalizations and in the deaths being counted. So making sure that we are doing enough testing and tracking the numbers stably over time is what is going to give us a signal on how we're going to do. Right now, we are trending upwards on all counts.
If I may ask you, how do you see this upward climb to last, what, 4 to 6 weeks? And different parts of the country getting affected at different times. Maharashtra at the moment, but slowly spreading to Uttar Pradesh, to Bihar, to Bengal. Is that the trajectory you see over the next 4 to 6 weeks, ma'am?
So if we look at the patterns of waves that have been seen in different parts of the world, the whole cycle of a wave is somewhere around a total of 12 weeks. And it is the pace of climb that counts, and then the decline that counts. You reach a peak, and over a period of time, it comes down, and the whole cycle lasts about 12 weeks. Now, when you have overlapping 12 weeks from different locations, the pattern can vary from the kind of sharp upward swings and the sharp declines that are usually patterns at a more local level. And what we are seeing is that some of the places that led in the past are leading again. Maharashtra as an example, and Delhi beginning to climb now. And these are just trajectories that we will have to continue to monitor in order to see how the pandemic declines in specific locations. There are some areas that have just begun to climb now, and for them, the climb and the deceleration will be a longer period than it will be for Maharashtra and Punjab, for example, which were early leads.
So it's very interesting what you're saying. From what you're saying, the states which saw an early spike in cases in March itself, the decline will set in earlier there, and you will now have new states that could be affected. Am I right? That and is it that all these states are seeing potentially a double mutant virus? Can we say that with some confidence, or new strains in different parts of the country?
I don't think we can say that it is the double mutant everywhere because we don't have the sequencing data. The data that we do have seems to indicate that in Punjab and possibly in Delhi, what we are seeing is largely the spread of the UK variant. And again, this is based on small numbers of strains that have been sequenced. In Western India, we are seeing B1617, which might be called the Indian variant if we use geography to describe these variants. But there are other Indian variants as well. There are strains that have been seen in southern India that are different from the ones that are seen in the West. Whether those will also have the characteristics of increased transmissibility is something that we will need to wait and see as we follow the trajectory of the pandemic, as well as the sequencing data that I hope will emerge much faster now than it has in the past.
The one question which people are asking again and again to us is, are these new variants immune to vaccinations? People who are taking the first dose are getting COVID, are turning COVID positive within a few days. Is that a cause of worry that the vaccinations, as they are in the country at the moment, may not necessarily give you immunity against these new variants?
The effect of a vaccine kicks in about 3 weeks after you receive the first dose of the vaccine. So if people are getting infected and sick after the first dose of the vaccine, it's likely that it is happening in the first 3 weeks after they receive the vaccine before we could expect the vaccine to work. Vaccines are not supposed to prevent infection. Vaccines are supposed to prevent severe disease and death. The fact that people get infected after they receive the vaccine, it should not be something that is considered unusual. Will the vaccines work against the variants? what we are seeing from data that has come largely from Western countries is that with many of the variants, the immune response as measured in the laboratory seems to be somewhat less effective against the variants, but the clinical data show us that the vaccines are still working against most of the variants.
Are you surprised, though, that a number of young people, people who may be under the age of 45, are also getting infected in this round of the COVID wave? What does that suggest to you, and should that be a cause of worry?
The fact that younger people appear to be infected in greater numbers is something that I've heard reported anecdotally. And what I really would like to know is the socioeconomic status of these younger people. Is it is it people
Because
across
it's very...
all ends of the spectrum?
Yes.
And I think we'll find that is not the case.
The other question, Dr. Kang, is that what are the solutions? The government is offering weekly lockdowns now, trying to restrict movement. Is that a solution to contain the second wave?
Our solutions haven't changed except for the addition of vaccine. Social distancing, masking, prevention of crowding are the public health tools that we need to be using, and these need to be accompanied by pushing vaccination as fast as possible. You brought up a really important point. You said double masking, but I think the quality of masks is something that we are not looking at all. If we look at people wearing masks on the street, you will see many of them are single thickness masks made out of knitted cotton, which are practically no use against the virus. So making sure that you have the right kind of mask, that the mask fits well, double masking in certain situations, I think is going to be an improvement that we will need to bring to the table.
I just wanted to also understand, because this is intriguing me. We are told that if you're in an open space like the Kumbh Mela or a large religious gathering, or indeed in a political rally, even if you don't have social distancing, you're less likely to get infected than if you're in a closed space. Is there any truth to that? Because this is a defense being offered by those who organize the Kumbh Mela or those who are organizing these political rallies, saying, look at our numbers, compare them to a Maharashtra or a Gujarat. How do you respond to that? Is there any validity in these claims that are made that the virus is much more contagious in closed spaces?
Ventilation really does matter. Air movement matters. But in all of the models that people have of behavior and how you can handle being in an open space without risking infection, nothing is the kind of bodies packed up against each other kind of situation that happens all too frequently in India. Remember that this is a virus that spreads mostly through the respiratory tract, and it is a question of how much of the virus you are exposed to. So whether you're indoors or outdoors, if somebody infected is breathing out, shouting, singing very close to you, then the number of viral particles that you will acquire can set up an infection. So it's not like open spaces are insurance against infection. It is a question of both distance and the amount of air movement surrounding people who are potentially infected and therefore infectious.
So net, as we look ahead, how do you see the picture? Dire, or do you believe things will gradually get better? Because I had Professor Brahmar Mukherjee from the University of Michigan yesterday suggesting we could even have 5 lakh cases per day, 3,000 to 4,000 deaths. Is it going to be as bad as that? Is the second wave going to really haunt us for a while to come? or is this something which, as you have said earlier, will go through a natural course?
I think it's very important to recognize that control is in our hands. It is something where relatively simple public health measures do work. What we need is to use those public health measures and use them effectively. What we seem to be dealing with currently is a virus that is more infectious than the virus that we had last year. We don't have data to confirm that yet for the Indian B1617, but we certainly know this about B117. So if you have a more infectious virus, that means that you probably will get infected with a lower infectious dose, which means the practices that we had used last year need to be implemented more rigorously this year, in addition to continuing to push vaccination. If we do nothing, yes, obviously the numbers are going to continue to increase because it's still about a third to less than a half of the population of India that has been infected or vaccinated up until this point. If we do nothing, the virus is going to continue to spread. And if you have spread, you will have cases that require hospitalization. You will have people who will die because of this infection. But there is a lot that we know. There is a lot that we can do. And I hope that we will continue to do both, push the public health interventions as well as the vaccination as much as possible.
Do you believe that India as a country has done well? Do you believe we mismanaged, particularly the vaccine policy? Should we be vaccinating all Indians now above the age of 18? Do you believe we need to review many of our policies given this second wave? Were we unprepared? Do we need to course correct?
There have been missteps. There have been all kinds of missteps, whether it was with testing or with treatment strategies or with getting vaccines ordered or getting vaccines out. Everybody has done that. I don't know of any countries that have performed exceptionally on many of those fronts. What I'd really like to see for India is that what we build is a system of iteration and a system of learning, so that if we figure out that something is not working, we abandon that and try out something else that does work. The importance of data and the importance of evidence in a learning health system cannot be overemphasized. And we really have a lot of opportunities to continue to improve.
Could I therefore ask you, would one of those changes be, I keep banging on about this, that vaccinate people above the age of 18 or 21, just open up this entire vaccine policy. We now are going to get vaccines, hopefully fast-tracked, even the foreign vaccines, but should we just open up the vaccine process to speeden it up?
I would hold back on the enthusiasm for we are suddenly going to have enough vaccines to vaccinate the entire country. There is a global shortage, and while we may have opened up the regulatory processes for approval, that does not mean that our supply issues have been sorted out. It's going to take a while for India and for the rest of the world to have enough vaccines. In India, I still think that we are in a very privileged position with access to vaccines. In terms of thinking about how we should use these vaccines, we have essentially two ways of going. One is to continue the priority populations if the goal is to prevent mortality. And if the goal is to get ahead of the curve and prevent transmission, then we should be doing all age vaccination for the ages for which vaccines have been approved for use. I think ultimately we're going to need to vaccinate everybody in the country, including children. It really is a question of balancing the availability of vaccines and our ability to deliver those vaccines. But we will need to vaccinate everyone over time.
How many marks are you going to give the governments, whether in states or at the center in India, on a scale of 10? Do you want to mark them?
I don't think this is one where you should really have a scorecard. I think it is a question of how do we learn from what we are doing and do better next time around.
But do you at least want them to stop these large rallies and stop these religious gatherings?
I think there is no question that mass gatherings are incorrect at this time. No public health authority would recommend having a large gathering of people who might be potentially infectious at a time when a pandemic is raging in a country.
I think that's as clearly as you put it. Hopefully someone is listening to one of the country's top virologists. You put the situation in some kind of perspective for us without alarming us. You've given us a bit of a wake-up call as always. Dr. Kang, thank you so much for joining me here on the news today.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.